Good morning and welcome to day 2 of the 7th annual Oswego County Safe Fair. I'm Teresa Wilson, president and founder of the Vow Foundation, and I'm your host and facilitator for today. Just give me a moment here and we'll get started. Okay, up first today is how community coalitions fight substance abuse with Tyler Ahart, Oswego County Prevention Coalition Project Coordinator. Tyler is a native of Oswego County and he's passionate about his community and the people within it. He has spent a lot of time with various local nonprofit organizations, including the Tobacco Free Network of CNY and the Central New York Arts Center. His area of expertise include media, public relations, and interpersonal communication. Welcome, Tyler.
Hi, thank you. I'm going to go ahead and screen share our presentation. Can everybody see this okay?
Yep, I can see it.
Okay. Okay, so again, thank you everyone for being here. I know things are a little bit different this year, going virtual. I just want to start, and again, thank you, Teresa, for the introduction. So today I'm going to be talking about, again, how community coalitions fight substance abuse. So again, my name is Tyler Ahart. I'm the project coordinator with the Oswego County Prevention Coalition. And the Oswego County Prevention Coalition is a federally funded community coalition that really got its start 4 years ago. Teresa Wilson was actually one of the original stakeholders who was behind the scenes pre-funding, and they kind of noticed that Oswego County was really, the opioid crisis was getting out of control, and that has a direct connection with its youth. And so they applied in partnership with Farnham Inc. for federal funding, and they were officially awarded in 2016 with the Drug Free Communities Grant. That is a 4-year grant, and again, we are currently in year 3, entering 4 this fall. So to continue, our goal is to ultimately reduce the rates of adolescent substance abuse within Oswego County. That's the umbrella goal. So every day it's important to reassess, why are we doing this? And it all circles back to that. Our goal is shaped by our mission, which is to increase developmental protective factors as we address adolescent substance abuse throughout the county. And again, this is shaped by the vision, which is a sustainable, drug-free community that supports health and wellness. And we take these 3 things, the goal and our mission and vision, and every month our community stakeholders come together to strategize and plan and initiate project implementation that address these 3 factors. So with this, our strategy, we look at our strategy. So every month these stakeholders come together to strategize. We have a group of 100% volunteers who dedicate their time, who are passionate about wellness, whether it's substance abuse specifically or mental health. They come to the table because they're passionate about Oswego County, they're passionate about youth, and they're just passionate about its people in general. The coalition chair calls important matters to vote. Our chair is currently Tori Decare, former police chief for the Oswego County Police Department. The coalition follows a strict set of bylaws which guide coalition business. These bylaws give coalition members a sense of ownership and that it is a very legitimate organization to be a part of. There are rules, there are matters do have to be called to vote, and that really helps structure the direction that we go in as we plan for the year. Our coalition is ultimately led by our 12-month action plan. And this action plan we'll get into a little bit more later on, but it is broken down into goals that are shaped by our survey data, which I'll also talk a little bit more. So some of our members are representative of different organizations, including United Way, OCO, Rural Health Network, and many more. No one is really required to be a part of any organization. Some aren't even to use their current affiliation as part of that. It's just about having that passion and having those goals that align with the organization's mission and vision. So I talked about how the survey data shapes our 12-month action plan. So we do this through our youth development surveys. So our core area of focus is strictly ages 13 to 18. This is for the surveys, but this is for that umbrella goal of fighting adolescent substance abuse that I talked about a little bit ago. So these surveys are conducted every 2 years. So our last was in 2018, before that 2016, which was the first year of funding, and again this year as well. So the surveys assess grades 9 through 12, and this really does rely on participation from Oswego County schools. This assesses past 30-day use, perception of risk, perception of parental disapproval, and perception of peer disapproval. So again, without participation from area schools, this really isn't possible. Homeschool students are a gap in the surveys. They are very difficult to get access to. The information is very private, but that's important to us to know that we use the schools because of the mass amount of students and the numbers is what matters. We need to represent the entire population as much as possible. So just to get to our discussion on surveys, the youth development surveys measure the core areas of opioids, marijuana, tobacco, and alcohol use. These surveys are 100% anonymous. Students are not required or mandated to take them in any way. And with that anonymity comes a little bit more flexibility and not having to go through all the channels of necessarily parental approval unless they require it. Some parents do want to talk with us about the surveys, but again, it's 100% anonymous and students are not required to take this. So some examples of some data that we pulled from our 2018 survey. Underage drinking was reported in 20% of youth in 2016. But we saw a decrease to 16% in 2018. The incidence of over-the-counter and prescription medication abuse went down from 4% use. And marijuana also saw a decrease in use from 14 to 11%. But I want to include these extra points about marijuana specifically. It saw the lowest level of perceived risk. So even though the use is reported down, there are factors that include with reporting, like I talked about, whether it's participation and authenticity in answers. But the lowest perception of perceived risk is a concern because it means that students see it as the least harmful substance. So it's that cost versus reward, risk versus reward. So marijuana also received the lowest rates of disapproval from parents. Now, I have a note here that this doesn't mean that parents necessarily feel that marijuana is okay. Rather, it's the perception that you perceive that the parents would rather them smoke marijuana than anything else. Now, the reason why to include that specifically is because as social media kind of has a bigger role in children's lives, and they've always kind of learned things from elsewhere, it's very important that parents or any student's primary caregiver really communicates to their child what their stance is on important issues, whether it's substance abuse, mental health, even politically. These students, especially in high school, they're not shy to these topics. So I wouldn't recommend waiting until you feel that they're really ready. Much like a small child with 3-4 years old, and they mimic curse words, things like that. Same with teenagers. They really adapt to what their family's values are, and they do branch out on their own. They do develop their own opinions and values at that age, but it's important that you let them know where you stand on these issues, that you feel that these things are, okay or not okay, or let them know what the risks are. It's also important to educate them on the facts, not use scare tactics, and let them know that and acknowledge that they're going to make their own decisions, but these decisions have consequences, especially early on. Looking at athletics, scholarships, habit forming behaviors, these things do have consequences. So again, it's really about communicating to your child, youth in general, what your position on these issues are, and really how you honestly feel about it. Because this perception is often, when I talk to parents, it's often very not aligning with how they really feel. Like, well, I wouldn't want my student using that, but they perceive, the perception is there that they think that, well, my parents would think it's okay. So again, it's having that conversation. So I talked about these surveys occur every 2 years. We are currently in a survey year. We were ready to go spring of 2020, ready to roll these out, full district approval and participation. And the pandemic came to Oswego County and everything was shut down. So rather than postpone indefinitely, which of course is always an option, we regrouped over the summer and strategized, and we chose to implement these virtually in the fall of 2020. So students had just returned to school, and we have found that we're still waiting on the data, but we have found that virtually has made things a lot more easier than the previous method, which was Scantrons and multiple choice. So this year we will likely see a change in the data, and there's different stressors to consider. So before the surveys in traditional years, we're looking at stress from a pretty average day, for students. They go to school, there's athletics, there's, pressure from school and, peer pressure and other factors like that. But students, things are different now. Students are most 100% remote. From our youth coalition, which I'll talk about a little bit later, we've gotten some insight into what their day-to-day looks like. And students, while on virtual, might sound appealing to some, not having to leave your house and things like that. And, maybe you can stay in your pajamas at your computer screen all day. But these students, their classes are, for the most part, 100% lecture-based. They're feeling very isolated, and there's not a lot of social interaction that's being given to them. A lot of interaction outside of coursework in their classes is kind of actually being discouraged to prevent any sort of dishonesty. So some classes and schools have really ramped up their policies because they're concerned about grades and exam integrity and things like that because of the looking up answers and things like that. So they're trying to really limit the contact between students solely for the purpose of those exams and all that private information. But students are really having a hard time not having that social interaction aspect that they're so used to. So we're likely going to see some different things this year. So the survey data is in the works right now. So we're hoping by November, December, we have some statistics to roll out and share with the county. So I want to talk about how this data is used. So we know why we do it. We know how we do it. But I want to talk about how the data is used. Once we get it, what do we do with it? So this data shapes our 12-month action plan. Then again, that's related to our mission and vision statement we talked about in the beginning. These plans are reduced by specific percentages in the action plan. So this is just an example. So in the area of underage drinking, our goal for our 2018 to between 2018 and 2020 were to reduce underage drinking by at least 3%. And so going from 16, which was in the previous data, to 13, which would be reflected in our data this year. Again, we would normally have that data by summer, but with the COVID, we've had to readapt and replan a little bit. So our projects that are outlined in the action plan are substance specific for the most part. Just some examples for underage drinking, sticker shock campaigns, and it's collaborating heavily with the Stop DUI program. And for opioids, prescription drug disposal drop boxes. So these are really our two core substances that we see. Marijuana is difficult to educate on with, there was some pending recreational legalization in New York State. The research is still always developing. And these are the two core substances that we really see causing and wreaking the most havoc in Oswego County with youth use. So I talked a little bit about, substance specific campaigns. I want to break into those a little bit more. So for example, I talked about with underage drinking, sticker shock campaign. So when we got the data, we know what kind of percentage we have to reduce by. We have to think with our coalition, how do we achieve this goal? And one of those ways is through these sticker shock campaigns. The ultimate goal of this is to reduce the sale of alcohol to minors. We've all seen the films and the footage of teenagers hanging outside of a Fast Track or a Sunoco, asking the right person, hey, can you buy me some beer? And this campaign is an effort to reduce that youth access. There is a heavy fine that goes with it for both liquor store owner who's at risk for losing their license and for the adult who purchases the alcohol for the students. This does rely solely on the partnerships with local liquor stores. 99% of liquor stores want to participate because of course they don't want to sell to youth, and they enjoy the warning labels that students, or you can see in the picture, are putting on their products. But again, you get the one out of 100 who really aren't interested for whatever the reason might be. And there are some barriers there. So we don't have 100% coverage when we do these campaigns, but for the most part, they're relatively successful. This project is specific to our youth coalition. It's important for our youth members to get out there, boots on the ground, meet with local business leaders, and really carry out this prevention messaging themselves. This ensures that they can relay the message to their friends, their peers, let them know what they're doing, and it does have a ripple effect. We have seen that. This is in partnership with the Oswego Police Department, and that they're a huge support for these kind of projects that we do, and they really support our youth coalitions, work that they do in the community. This is just a photo from the sticker shock campaign again from this past winter. Two of our youth members, our youth leader, a member of the Oswego Police Department, a local business leader. The support again, this campaign really relies on a lot of moving parts to make sure that this happens and this messaging goes out successfully. So other campaign I talked about, so we talk about underage drinking as a core focus, and so is, again, with opioids, prescription and over-the-counter medications. In the surveys, Youth Access reported a lot of at-home and a lot of at-home access. So we know that there's some of us probably have some unused and expired prescription pills in our cabinet that we never got rid of. Might have been from wisdom teeth removal. We never really needed them, didn't really want them. Maybe we took ibuprofen instead. But there's often a gap in always knowing where those are. And I doubt that any of us can tell exactly how many are in a bottle. And, if your student, for example, gets off the bus at 2 o'clock, maybe there's a friend with him, they hang out at the house for a couple hours, you're not home till 5 o'clock. Those substances are at risk for theft and even use by those students. At the very least, if you feel that, well, my student wouldn't do anything, like they wouldn't take those substances, there's a chance that that's true. But the other alternative is to sell these. It's very easy to sell these kind of things at schools, even to adults. We have seen high school students selling to people who use in Oswego County, so to adults. So there is that aspect as well. And most teenagers do appreciate money. So that's something to be aware of. So the way we combat this at home use, and the way we kind of help protect people from, leaving these extra substances around their home is with these safe disposal drug drop boxes. So we talk about collaboration with local business owners for sticker shock, but this Dropbox program relies on participation from police departments. Without support and participation from our local police, this project would not succeed. These boxes are paid for through our grant funds. So we pay for them and we supply them with the department, but it's up to them to secure them, to monitor them, and to empty them when they're full. So I know, for example, we currently have 3 drop boxes in the county that we've provided. So Oswego Police Department, Fulton Police Department, and Pulaski. I know Oswego and Fulton handle incineration themselves. So when the box fills up, they take the bag out, they weigh it, they send me the weight so I can report them, and then they incinerate those contents. Pulaski's Dropbox is the only exception. They were purchased through a different program, and that program requires that those be picked up by it's a specific mail carrier that comes and picks up the contraband. They ship it back to their company, they weigh it, and they input the data virtually. So it's an online database with this Dropbox, and then they incinerate the contents themselves. But either way, that's a lot of legwork for these departments to go through. So we understand the benefits. We understand this needs to happen, but we're always thankful that the police dedicate the time, the manpower to watch this, secure this, empty it, and report the weights to me and incinerate. I'm always thankful, and I always try to send my thank yous to them when possible. So you can see the weights here. Fulton, 409 pounds. Pulaski is a relatively new one. The weights are significant, what we're seeing in 12 months or more of a time. They empty them about every 3 to 4 months. They fill up, they empty them, incinerate, and send me the weights. But these are prescription pills and medications that would otherwise be at home. They would be in maybe someone's grandparents' home that are just sitting there, or parents. And there's that youth access. So these are all things that could put the community at risk and put youth at risk. So it's removing those unwanted contraband from the community. So why this really matters. So we talked about the youth aspect, the youth access, getting it out of your home, and not keeping and putting your family at risk. But the other aspect of this that is really important that we talk about is there was a previous time when consumers were told it's okay to flush their prescription pills. Just go ahead, throw them down, crush them and throw them down the sink, or flush them down your toilet. It's the safest way, is what people were told. But the Department of Environmental Conservation has reported and continues to report that fish and other aquatic wildlife are experiencing behavioral and physical changes due to these exposures of these low-level trace found and of medications in the waterways. Waste management has come a long way. There's a lot of new filtration processes that we're seeing, but we're still seeing these low trace levels of prescription medications in our waterways. And this is affecting the ecosystem. This does affect pretty much everything connected to our waterways in our community. So that's one of the biggest ways, this one of the biggest reasons, excuse me, why we promote safe disposal, to protect people, to protect our children, but also to protect our environment. So it's definitely a two-pronged approach. So thinking that it's, flushing it's harmless is not the case. And if people are really unable to make it to our prescription disposal drop boxes, we do have at-home disposal kits that we offer to community members for free, of course. We purchase them and we mail them or bring them to people whatever they need. They're known as the Terra bags. And these at-home kits are essentially you rip off the top, you fill it with warm water, place your prescription pills in, they dissolve, you seal it like a Ziploc, and you throw it in the trash. This is another at-home method that we really try to promote this for seniors, especially who have really low access to getting out and making it to these drop boxes. And if that's not a viable option, throwing them away is still it's still a means to an end. If someone absolutely has to throw these prescription drugs out, they have no way to get to these drop boxes, they have no access to the Terra bags, we recommend that community members place the drugs into some really unwanted refuse, whether it's cat litter or things like that, and throw them in, try to bury them in your trash, because obviously, animals dig through your trash. That puts, again, we talk about the ecosystem at risk, but also it puts the community still at risk, because people do dig through garbage looking for unused prescription medications. So again, that is really the last option. So we try to give the community members lots of opportunities to really avoid having to throw them away. Again, we offer these free to Terra bags to community members, and we really try to promote these prescription drug disposal drop boxes. One final note on the drop boxes is they are 24-hour access at these police departments. I believe with the exception of Pulaski, because it is in a county building that is connected to the police department, but Fulton and Oswego are 24 hours, completely anonymous. There's no paperwork, there's no harassment. You don't have to talk to anybody. You don't have to remove any of the labels or anything like that either. You can just put them in the original containers, and then the police department incinerates those. So I like to promote that as well. That is, people get concerned that there's paperwork to be filled out, that there's someone you have to talk to. It's completely hands off. So again, just try to make use of these prescription disposal options. So we talked about how the Sticker Shock movement is 100% youth project, and that we really want the youth out there meeting with community members and getting hands-on with these projects. So our youth that I talked about is our Youth Creating Change Coalition, or YC3. This is a youth-led coalition. The work that they do parallels the work of our adult coalition, and that these students meet regularly. And just not once a month, they meet every other Monday, and they come together and discuss strategies to reduce adolescent substance abuse in the county. They do focus on mental health and positive messages as well. Again, they meet every other Monday, and the only criteria we really have is the age stipulation of 13 to 18, and they must be a resident of Oswego County. These students are representative of different districts, Mexico, Oswego, Fulton. So the district isn't an issue. Even homeschool students, we currently don't have any, but again, that's not a barrier we'd like to see. So any student really is welcome. And we are 100% virtual now. So if anything, it's easier for students to meet more regularly. Before, they would have to come to one of our branch offices, and they would meet, 5 to 6 p.m. or something like that. But now we're 100% via Zoom. So students are able to meet with us much more frequently and stay more engaged. So it's really the best time to recruit and, recruit some new members and see some new faces. So just to continue our discussion on YC3, the work is youth-led. It's a peer-to-peer movement, which means us as adult leaders, we serve to support them, protect them, and give them whatever they might need. But really, the work depends on them. They let us know what they're seeing. Most often, the Adult Coalition is a few months behind in trends, whether it's social media trends or drug challenges that they use for social media popularity. We're often very far behind. So they really keep us informed on what's going on, and they will help us keep our focus on what's important.
I can send you
So again, the youth leader serves to guide and support, but the youth are responsible for projects. The projects we talked about already include sticker shock. Some other ones are toilet talks and just general community outreach. So toilet talks would be
So that should square up that portion.
Teresa, can we mute that mic for me? Thank you. Just to expand on toilet talks a little bit. SUNY Oswego, we adopt this initiative from them. They take these infographic flyers, quick to read, and they place them in bathroom stalls, a place where everybody's got to stop in at some point. And the students want to really duplicate this activity. So they picked substance-specific topics. They got principal approval from their schools. Once they had the approval, they printed them, laminated them, and they placed them in the stalls where they wanted to, where they want them specifically in their own schools. That's what we talk about when we say a youth-led movement. That was something they wanted to do. We offered the support, and they handled it though. They got the approval and then they carried out the work. And community outreach too. During COVID, it's harder for our students to get out in the community. I know the farmers market was still going on, but we still have to consider not putting them at risk. And, so they really do miss getting out in the community and participating in those events like Harbor Fest and things like that. I know the Youth Bureau is hosting a drive-through Halloween event this year. And I know our kids are very excited to participate in that, just to kind of get out there again and interact with people, and just in any way they can. So another thing another opportunity that the students get to experience for being part of YC3 is they get to attend these national conferences. In February, pre-pandemic, two of our youth leaders were elected to attend our Community Anti-Drug Coalitions of America Leadership Forum in Washington, D.C. Myself and our other youth leader, we have adult trainings that we attend, and there's youth trainings that they attend. So they really they really have their own agenda while they're there. And then the highlight of that trip really is that each congressional district gets to meet with the representatives. So our students got to meet one-on-one with John Kako for like 20 minutes, just to talk about some different things that they're doing. And he offers his support in any future projects. And that kind of hands-on Capitol Hill Day experience is really invaluable for them. It's very significant. One of our youth leaders at the time was a high school senior, so she took that knowledge and she's off on to bigger and better things. But the young gentleman in the photo, Avery, he was a sophomore at the time, so now he's a junior, and he has recently stepped into a leadership role for the Youth Coalition, taking that experience and continuing to lead the coalition using what he learned. So I just want to recap a little bit. So some of the key points, some of the key takeaways that we talk about why these community coalitions are important and what we can do for the community. We use strategy that aligns with our mission and vision, our goal to reduce adolescent substance abuse in the county. I say that's it, and not that it's an easy job, but that's the main focus, to never lose sight of that's the goal, is to keep our kids drug-free and sober as they grow up and they become leaders in the local area or elsewhere, just to kind of, have that impact. Youth development surveys to measure change in trends. We do these every 2 years, and we use the data to plan our future projects and to really assess what trends are going on and what students are using and where they're using, and what they perceive as harmful or unharmful with that area of perception. Sticker shock campaigns to reduce the sale of alcohol to minors. Again, this partnership with local businesses is essential to this ripple effect that these sticker shock campaigns have. And safe prescription drug disposals to keep unused drugs off the streets and out of our waterways. Again, really promote this message even mouth to mouth. If you know someone who has excess prescription drugs, whether it's a grandparent or someone else in your family, maybe if you have the availability, take them down to them and dispose of them for them if they don't mind. If they know they don't need them, it's important to be aware of those things. Be aware of where your medicine is, and it's important to keep it locked up and safe. And you might trust your kids, but you might not trust your kids as friends who come over after school. In those scenarios, you can't be everywhere all the time. So that trust is important, but again, it's also important that if they're unused or unwanted or expired, that you dispose of them safely. And our Youth Creating Change Coalition, or YC3, to shape young youth leaders. This is where that peer-to-peer comes in. Our work for our adult coalition promoting drug-free lifestyle for kids is one thing, but it's important that this messaging comes from kids and it comes from them honestly. And that's really that ripple effect I talked about, that it's a two-pronged approach. Adults promoting prevention messaging to kids and communicating to them effectively. And it's also the peer-to-peer movement as well, that they can tell their friends, hey, I'm not okay with doing that, or I'm not interested in that, or that kind of behavior is going to have consequences, to make those educated decisions. So just to end here, I encourage any of you to get involved if interested, if you're not already. Now is the best time. While we do miss that face-to-face interaction where we used to have in our month-to-month meetings, we are 100% virtual now. So these meetings, again, are all via Zoom. And so based on work availability, it is a little bit easier. Instead of having to commute to an office or a site location for these meetings, it's all online now. I included my number and email there. If anybody ever has any questions or needs resources, whether you're a parent or you're concerned about a friend or anything like that, I can get you in touch with a network or someone who may have those resources or additional information. Again, I have Dropbox information. I have doTERRA bags for free for at-home disposal kits, and an endless stream of network that can really help people get what they need, whether it's in the field of substance abuse, mental health, interested in training, anything like that. And again, I hope to see this data that we're working on soon come out, and so keep an eye out for that, and we'll try to publicize those new trends as much as we can.
Thank you, Tyler.
Thanks, Teresa.
Does anyone have any questions for Tyler before we move on? I don't see any questions in the chat, so I think we're all set. Thanks, Tyler.
Thank you, Teresa.